Okay, so bear with me while I'm using this very weird setup for this video because I want to show you how to use a pregnancy pillow or how to make your own pregnancy pillow. So this is going to be my little pregnant tummy. Okay, so pretend this is my pregnant tummy. Pregnancy pillow is purely there to support your tummy and the muscles on the side that are pulling and stretching when you are pregnant. And it also can elevate you a little bit. So you get a lot of different pregnancy pillows. My favorite one was this U-shaped one. I saw that years ago and I'm really sad about it because it was so comfy, but it took up half of the bed. So if you have a pregnancy pillow or if you have a makeshift one that I'm going to show you now, there are 3 pressure points that you kind of want to focus on. Or if I say pressure points, maybe not pressure points, just like points. The first one is obviously your stomach. It can pull if you lie on this side. It's pulled down, obviously because of gravity, and it can actually be quite sore. Your ligaments are already stretched and sore when you are pregnant. Now, when you have to turn around or you just sleep, it can be very uncomfortable. The second one is between your knees. You want some kind of pillow between your knees because it helps for any pelvic pain. When you are pregnant, all your ligaments relax, and that can cause a lot of strain on your pelvis. You've probably seen or felt pregnant women late in pregnancy, they often joke that they look like they waddle like a duck. It's because the ligament at the pubic symphysis right here, it softens up, so it gets really sore to walk. And if you sleep with your knees closed, which is difficult because if you're pregnant, you can't do this anymore. Obviously, I've got a balloon in, but you cannot sit with your legs like this later on in pregnancy because there's just too much stomach behind. You kind of naturally sit with your legs apart because your stomach is in between. Or, you don't really want to sit like this, but that's kind of the position that you assume. So you can't put your knees together, but if you sleep, your knees are going to kind of be together, if you like more in a straight line, but it's kind of comfortable. So you want to put a pillow between your legs just to get your pelvis more straight, otherwise your pelvis is tilting, and that tilting of your pelvis. So if your knees go together, your pelvis goes out. You can see, like, if these are my legs, if my knees are together, my pelvis tilts out a little bit. That causes extra strain on this pubic symphysis that's really sore. So you want to keep them aligned as much as possible. So you want a pillow here. And then obviously you want something underneath your neck because you can't sleep with your head down, it's going to be too uncomfortable. So these are the 3 points that you want to focus on. A pregnancy pillow has all of that incorporated. If it's like a straight pillow or a J pillow where you can use the top of the pregnancy pillow as like a pillow, or one that goes all around. Mine literally went all around so I could just easily turn sides. That's the nice thing about it. If you just have one side, every time you turn, you're going to have to drag your pillow around. But it's doable. If you have a makeshift pillow, you can do exactly the same. So, let me show you. Whew, my back. Okay, so this is kind of what you will have if it's a normal, like full-on pregnancy pillow. If you have just the J one, that's the vibe. Or you can have it like this. So what's the idea? It is difficult sometimes to get in. What I used to do is I would lift one leg. If it's a makeshift pillow, you just move it. Okay, then you sit down. It's a U pillow. You just lift the one side and then this side comes over. Put your leg in between, so it's between the knees. Your tummy is going to be in the way, so you're going to have to do this like slowly. And the point is to have one of these pillows underneath your tummy like this. You've got one between your knees, and then one of your arms is probably going to go underneath because you can't sleep on top of this. It's going to be an awkward position. So you're going to go underneath there, and your tummy is going to love you for this because now this is supported, so there's nothing pulling on the ligaments here. It's a makeshift pillow. You can just literally do this on your own. You don't even have to have those pregnancy pillows, but they are really nice. You can add another pillow in here if you want, and I'll show you what I did with those two just now. If you need to turn around, take your leg out, depending how heavy your stomach is, obviously. I had to help my stomach a little bit. Move over, pull this between the legs, pull this underneath, and rest my stomach. And there you go, you can sleep. It doesn't get tired to lie completely on your side. So I would just pull it up a little bit more and I would shift my buttocks a little bit. That I'm like semi-declined, but I'm not on my back. Remember, at this point in pregnancy, you've got to sleep on your back. So now my stomach is supported. if I want to use those big ones, I need to get up there. Ugh. It's so much easier if you're not actually pregnant. So towards the end of pregnancy, because baby is taking up so much space here, they also take up lung space. So you tend to breathe faster. Just check this video that I took. I wanted to capture the movement when my girls were kicking. You can see how fast I'm breathing just because I'm purely out of lung space. Then you want to sleep a little bit elevated. And that's where you can now incorporate these pillows. So you can put them 1, 2, whatever works for you. You're going to move slowly, okay? So just be patient. And then up a little bit more. This is where the makeshift pillows are nice because you can just like shuffle whatever you want. And this one, for the pregnancy pillow or normal one, is very nice to pull up here behind my back. Like this. Like you can be covered in pillows. I mean, this is just the way of your life going forward. So you can do like that. I've got this one here, under the arm here if you want. If you have a full pregnancy pillow. If you don't and you have your separate pillows, you can even move up. And I promise you, I'm not kidding. For the last 2 months of my pregnancy, and I slept with my hands above my head here, support behind my back because this part is also killing you. And this is how I slept. It's actually really comfortable. I might just take a nap here. Wear just pillows everywhere you need, and your partner, I mean, this is a 3/4 bed, so I didn't do it on the double bed. You're probably going to take most of the bed. But it's just for a couple of months, and I think it's okay if you take over a little bit. They've got their space there. Oh, that was way too close for comfort. If you find this video useful, check out the rest of the videos that I have on my channel. If you subscribe, you will find a lot more videos about pregnancy, childbirth, newborn care, and taking your baby home. If there are any more questions that you have, please feel free to share in the comments below, and I'll see you in the next video.